Welcome to another episode of Med Madness, your go-to podcast for mastering the USMLE Step 2. Today, we're diving into the critical topic of postoperative abdominal wound complications, an essential area for medical students to understand. This discussion is vital not only for your exams, but also for your clinical practice, as proper management of wound complications can significantly impact patient outcomes. We'll cover everything from defining the condition, exploring symptoms and diagnostic methods, to discussing treatment options and sharing a real-life case study. Next, let's explore the symptoms and clinical presentation. Patients with superficial wound dehiscence typically present with scant serosanguineous fluid drainage from the wound. There might not be significant pain or systemic symptoms. In contrast, deep wound dehiscence can lead to visible exposure of internal organs and is often associated with severe pain, risk of infection, and signs of systemic distress. Recognizing these symptoms early is crucial for appropriate management. Next, let's outline the diagnostic methods and tools. The diagnosis of wound dehiscence primarily involves clinical examination. For superficial dehiscence, regular wound inspection and monitoring for signs of infection are key. In cases where infection is suspected, such as with necrotizing fasciitis or abscess formation, a CT scan of the abdomen and pelvis can be invaluable. This imaging helps in identifying the extent of infection and guiding further intervention. Next, let's describe the management and treatment. Management strategies differ based on the type of wound dehiscence. Superficial wound dehiscence without signs of infection can be managed conservatively. Regular dressing changes are essential to facilitate secondary closure by removing excess fluid, closing physiologic dead spaces, and debriding non-viable tissue. Deep wound dehiscence is a surgical emergency due to the risk of bowel evisceration and strangulation. Immediate surgical intervention is required to repair the fascia and protect the abdominal contents. Infected wounds require systemic antibiotics and potentially surgical debridement. Next, let's consider a case study to illustrate these principles. A 55-year-old obese male patient underwent abdominal surgery. Within a week post-operation, he noticed a small amount of serosanguineous fluid draining from his wound. On examination, the wound edges were separated, but the fascia was intact, indicating superficial dehiscence. There were no signs of infection, such as erythema or purulent drainage. The patient was managed conservatively with regular dressing changes, which facilitated healing over the following weeks. In a contrasting scenario, if the fascia had been compromised, immediate surgical intervention would have been necessary to prevent severe complications. Finally, let's summarize the key points. Understanding postoperative wound complications, particularly wound dehiscence, is critical for effective patient care. Recognizing the difference between superficial and deep dehiscence, knowing the appropriate management strategies, and acting swiftly can significantly improve patient outcomes. Remember the importance of early diagnosis and management to prevent severe complications. Don't forget to engage with our pre- and post-podcast quizzes and Anki flashcards for a comprehensive review and reinforcement of today's topic. Thank you for joining us on Med Madness. Stay tuned for more insightful episodes and keep pushing your medical knowledge to new heights. For more lifelike voices, higher character limits, and dubbing content in other languages, head to https://11labs.io?UTM_source =11labs_GPT.